Healthcare in America is a complex, fragmented system that can be extremely difficult to navigate. For some, it's harder than others.
This is Shonda, a 50-year-old black woman living in a low-income neighborhood in the inner city. She has diabetes and hypertension, but tries to stay as on top of it as she can. One day, Shonda wakes up with a bad cough, a side effect of the Ramipril medication she is on. It was manageable for the past couple days, but now it has gotten a lot worse. She was planning to go for a walk around her neighborhood to get some exercise in, but is no longer feeling physically up for it. Fortunately, Shonda remembers that she has a doctor's appointment later that day. Because of some policy change, her former doctor no longer accepted Medicaid, so it's the first time she'll be meeting with her new doctor. She makes a mental note to ask her doctor about the intensity of her cough. Just like every day, Shonda gets dressed for work early in the morning and walks to the nearest bus stop, which happens to be about 15 minutes away from her home. The bus ride is another 10 minutes to the metro station, where Shonda takes a 30-minute metro ride to get to the neighborhood she works in. Shonda is a home health aide, and the home she works at is a 10-minute walk from the metro station. Today especially is a harder day to work because of the cough. Instead of working from 8 a.m. to 6 p.m. as she would a typical day, she works until 1 p.m. so that she can make her appointment. Of course, in order to take the time off, Shonda had to work a double shift last week. At 1, Shonda changes, leaves from work, and waits for the bus to take her to a stop that is a 10-minute walk away from her doctor's office. Finally, she arrives at the office and is told by the receptionist to have a seat in the waiting room. As she sits and starts to observe the office, though, she starts to feel uneasy. She knows the physician she is seeing today is a white male, but all of the portraits on the wall reflect white males. She wondered, are there any female physicians? Are any of them physicians of color? She starts to look through the brochures laid out on the table, but realizes that she doesn't understand some of the conditions that are written. What's more, none of the content reflects her racial or ethnic identity. At last, Shonda is called in to see the doctor. Right away, he starts talking to Shonda about her medical problems. Shonda is taken aback that he does not introduce himself and is overwhelmed by the speed at which he is talking. He lectures her on the importance of healthy eating, especially for someone with diabetes, and tells her to eat more fruits and vegetables. He keeps talking about how she needs to be more proactive with her health in order to avoid even more expensive treatments later on. Shonda quietly nods, but is reserved. She knows that the nearest grocery store selling healthy foods is 40 minutes away from her home. The cheapest food available is from nearby fast food restaurants, and her local grocery store is primarily a liquor store. She thinks to herself, does my doctor think I don't care about my own health? Finally, the doctor tells Shonda that hypertension and diabetes are risk factors for eye disease, and that she will need to start following up with an ophthalmologist at least on a yearly basis. He writes down the name and address of a referral and hands it to Shonda, but she sighs. The specialist is located more than an hour away from her home. She then immediately asks if that doctor takes Medicaid. The doctor thinks for a second, says he doesn't know, and before Shonda could say anything else, he opens the door and shouts to the nurse down the hall if she knows whether the ophthalmologist takes Medicaid patients. Shonda blushes. She's embarrassed that her personal information was displayed so insensitively to the whole office. As Shonda leaves the office, she is charged a copay for her visit. As she begins her long commute back home, she realizes that she forgot to ask the doctor about her cough. Looks like she'll just have to tough this one out.
It's important to understand that although Shonda's story is fictitious, it accurately depicts struggles that many Black and brown people in America face in the healthcare field. As healthcare professionals, it is our duty to understand the nuances and backgrounds of each patient to reduce the inequities faced by communities of color. As we remember Shonda's story, and the story of countless others, we must keep these questions in mind. What was it about Shonda's healthcare experience that showed the lack of empathy or cultural humility? What was it about the design of the healthcare system that may have perpetuated or normalized the provider's behavior? What could have been done differently?